Okay. Good morning, everybody, and thank you for coming. And I'm joined by one of the greatest leaders on women's and reproductive issues that America has, Senator Patricia Murray. I'm going to say such a fancy thing, you know. You can call me Charles. You can call me Al. Get it? It's a song. Thank you for being here, everybody. And I want to thank Senator Murray for introducing the emergency care resolution we'll be voting on later today. Last week, we learned of this heart-wrenching story of Amber Thurman of Georgia. She died. She died because abortion bans in her state prevented her from getting life-saving emergency care. It's the first known case of a woman dying because of new abortion laws in the wake of the MAGA Supreme Court's disastrous repeal of Roe. Doctors said her death was preventable. This was a prime example of the government interfering in a life-saving medical decision. Exactly, unfortunately, what is envisioned in the MAGA Project 2025. Sadly, she is not likely to be the last. A person's ability to receive life-saving care, including life-saving reproductive care, should never hinge on which state they live in. Georgia's case is particularly horrifying because they have one of the highest maternal mortality rates in the country, and it disproportionately affects African Americans. What happened in Georgia is a direct example of how abortion continues to exacerbate the racial disparities that we see in maternal death. Amber's doctors didn't perform the medical procedures they knew because of Georgia's law. She went into septic shock. Her heart stopped, and all the time while the doctors did everything except the medically sound treatment she needed, because Georgia law didn't allow it. In our country right now, doctors are calling lawyers on probably an hourly basis to ask permission before they treat a patient. And that is just very, very wrong. That's not America. Today, the Senate will vote on a resolution led by Senator Murray that affirms the Senate's position that every person has the basic right to emergency health care, including abortion care. It's a simple idea that emergency care should be a right for all, and that doctors should never be afraid of doing their job while making life and death decisions. How on earth could anyone have a problem with that? Come on up, Maze. Democrats will also bring up legislation led by Senator Baldwin to create a grant program that will assist with travel-related expenses for those seeking an abortion. This fund would help people overcome financial barriers like transportation, lodging, child care, if they need to travel out of state for this kind of care. Perhaps, if Amber had access to this fund and could have left Georgia, if she had the federal resources to move quicker to get her care, perhaps she'd be alive today. I thank Senator Murray and Baldwin for leading these two important bills. I thank Senator Hirono for joining them. If passed, those bills will save lives, and I'm proud to support those bills and hope our Republican colleagues will support them as well. Unfortunately, when it comes to abortion, Donald Trump and Senate Republicans have kept pushing the same argument again and again and again, that abortion is best left to the states. The tragedy of Amber Thurman's death shows exactly why leaving abortion to the states is such a dangerous idea. My Senate Republican colleagues say abortion should be left to the states. What do they have to say about states like Georgia, where abortion laws get someone killed? I hope today we see a tiny ray of light amidst so much darkness when it comes to reproductive freedoms. I hope my Republican colleagues support the legislation today. To say no would be a cruel, heartless message to send to the American people. Senator Murray, and I'm going to have to do further my responsibilities. Thank you.
Well, Donald Trump has been loudly bragging about how he ended Roe v. Wade. He's been making the outrageous claim that everyone wanted that. Meanwhile, Republicans have been totally ignoring the horror and heartbreak that has now been unleashed, even as women and doctors are speaking out about it every single day. Here in America, in the 21st century, pregnant women are suffering and even dying, not because doctors don't know how to save them, but because doctors don't know if Republicans will let them. I spoke about this at length last week, but new reporting about the tragic deaths of Amber Thurman and Candy Miller tells the story with brutal clarity. There are children in Georgia today who are growing up without a mother because of Republican abortion bans. And the painful reality is these may be among the first stories reported in such detail, but they are most certainly not the only ones. The data shows in Texas, maternal deaths skyrocketed after Republicans enacted strict abortion laws. How does anyone shrug that off? How does any Republican think the chaos their bans have caused will somehow blow over? No woman is ever going to forget when she was sent off to miscarry alone after her doctor said, "Look, I know your life is in danger, but I'm not sure I'm allowed to save you right now." No husband is going to forget calling 911 in a panic after finding his wife bloody and unconscious. No child is going to forget for a single day of their life the mother that was taken from them by Republican abortion bans. This cruelty is unforgettable and unacceptable. Democrats will not let it become settled status quo. Americans will not let it. That is why last week I introduced a simple resolution which reaffirms a very basic principle that when you go to the ER, they should be allowed to treat you. When your life is in danger, doctors should be able to do their job. When you need emergency care, including an abortion, no politician should stop you from getting it. This should not be controversial, especially if everyone who talks about protecting the life of the mother seriously means it. After all, this is what emergency care is for, saving the life of the mother. I really want to emphasize that. We are talking about women whose water breaks dangerously early, or who are experiencing uncontrollable hemorrhage, or sepsis, or preeclampsia. These are the patients we are saying doctors should treat under the basic right to emergency care. Today, as you heard from the leader, we're going to try and pass this resolution, and we're going to see if the Senate can come together with one voice and tell women, we want to put your health first, we want to put your life first, we want to make sure you get the care you need in an emergency. It's a simple message, but sadly, it has now become a necessary one. Now, I don't know if Republicans are going to let us pass this or not. Republicans sometimes talk about protecting the life of the mother, but frankly, they have yet to lift a finger to make sure that doctors will do that. So we'll see where this falls today. But even if they do block this resolution, I want you to know we are not going to stop fighting to help protect women, to get everyone the care that they need, and ultimately to restore reproductive rights Donald Trump ripped away. Mazie.
I want to thank Senator Murray for her continuing advocacy on behalf of women in our country, and I'm glad to join her and Chuck Schumer today and all the other members, Democratic members, who are very much on the page with us. We know that when Roe v. Wade was overturned, chaos and confusion followed. And if you do the research on what was going on in our country before abortion was legal through Roe, you will find that thousands of women throughout our country were dying from botched and illegal abortions. And now we're back to that time. How can it be? Roe v. Wade was supposed to provide the women in this country a constitutional right to abortion, a constitutional right to freedom of our own bodies, control over our own bodies. So I always thought that a constitutional right was supposed to be protected by the United States Supreme Court, not shunted off to the states, but there you have it. Anyway, when the Dobbs decision came about, restrictive laws and abortion bans were passed by nearly half of all states. Some 20 states rapidly enacted anti-abortion restrictive laws. These laws impact some 23 women throughout our country of childbearing age who live in these states, who do not have control over their own bodies. So when a woman is experiencing complications from pregnancy, she should be able to trust that she will get the emergency care that she needs. And that is why Congress passed EMTALA, a federal law that ensures patients access to emergency care, including abortion care, nearly 4 decades ago. But instead of affirming this law, this Supreme Court that brought us Dobbs punted on EMTALA, leaving its status and the health of women across our countries in question. This is more than dangerous. It is fatal. And we are all reminded of the death of Amber Thurman, a 28-year-old mother who went to a hospital in Georgia after experiencing treatable abortion complications just weeks after Georgia's inhumane abortion ban went into effect. And this is the reality we are facing. Women are dying because of Republicans' abortion ban. It is horrifying. That's why today, Senate Democrats will seek to pass a resolution affirming that every person has the basic right to emergency health care, including abortion care. This is as fundamental as it gets. Do women deserve to die? Of course not. Nobody deserves to die, but do we deserve to live? That's the question. Should we be condemned to death because of Donald Trump's Supreme Court? And this should be a no-brainer for all of my colleagues, but Republicans' obsession with power and control over women has gone so far that women in our country are dying for lack of this kind of care. So just as they've blocked our attempts to protect access to contraception, IVF, and more, I hope that today they will vote for this basic resolution that will provide emergency care. You know, I would like to see the Republicans truly give a rip about what happens to women in our country. Thank you.
Thank you. Happy to take any questions. Yes.
Vice President Harris today said she would support the filibuster carve-out. If Dems were, or Roe, if Dems were to retain the Senate majority, do you think there would be the votes there to support that alongside her?
I am confident I and many of our colleagues will do exactly as Vice President Harris said today, which is to make sure that we restore the rights of Roe to every woman in this country. Yes.
Thank you, Senator. Bernie Moreno, who's challenging your colleague, Sherrod Brown, in Ohio, said that women, said in the town hall last week, that women were single-issue voters as it pertains to abortion. Last night, former President Trump said all they can talk about is abortion. That's all they talk about, and it really no longer pertains. What's your reaction, given the context?
I have no idea what they are talking about. This is a basic health care issue for women in this country. We have all seen and felt the impacts from neighbors, friends, relatives, women we've known, stories we've heard about what happened when the Supreme Court took away the rights under Roe v. Wade for women to make their own health care decision. Women and many men are rightfully angry about this, and they will go to the polls on it. Yes.
Can you talk a little bit about why this was introduced as a resolution as opposed to a bill text that would actually change the language of EMTALA?
Because in the time frame we have, knowing that women are now dying because they cannot get the care that they need in an emergency room, we want to make it clear that Congress's intent is that women can get life-saving care when they go to an emergency room anywhere in this country.
Can I just add something here? Look, I see childbearing women in this very room. And I think it's horrifying that you are not going to be able to, if you live in one of these states that limit abortion, you will not be able to get the care that you need. It's just horrifying. And as I said, there was a time when women in this country were dying because of illegal and botched abortions. And this decision is taking us back to those times. And we should all rise up in more than protests. That anger should be channeled into making sure that we are protecting a fundamental right of the women in this country and the families and the people who share our views. That we are not neglected. And you know what? Anybody who says that's all they can talk about, oh really? Sure, we're going to talk about fundamental rights. And if we don't protect fundamental rights, what other rights are we going to not protect in this country? What's next? Who's next? They should think about that.
Well, one of the concerns from the Democrats and Republicans who voted to keep the filibuster in the past is that it cuts both ways. Are you concerned that if Republicans win a majority and decide to, the filibuster has already been carved out or is on track to be carved out, they could do the exact same thing and institute a national abortion ban if Congress is controlled by Republicans, the White House is controlled by a Republican president?
What we are talking about is a simple procedure to allow whenever rights are taken away from someone, that the U.S. Senate can, without being blocked by a filibuster, be able to restore those rights. I don't see the Republicans talking about restoring anybody's rights anywhere, so I'm not worried.
But do you have concerns that it could go the other way?
I have concerns every time I think about the Republicans in charge here in Congress for thousands of reasons.
Can you respond to some criticism from your Republican colleagues who think, these show votes are a waste of time and that, you guys would be better served working on other things?
What can be better right now than making sure that if a woman has sepsis, or she is hemorrhaging, or she is on death's door, what are they saying? That we shouldn't be talking about this? We should just let women die? We are not going to do that. We're standing up to make sure women right now, as soon as we can get this passed, can go to an emergency room when they are about to lose their life and get the care that they expect to get. I don't see a problem with that. I don't see why Republicans are not just going with us and voting on this.
Yeah, should we be talking about somebody who wants to be a dictator from day one and start to deport millions of people in our country? Should we be talking about that? Who loves dictators? I wouldn't mind talking about all that, but you know what? It is really, really important to all of us to talk about a fundamental right that half of our population no longer has. As far as I'm concerned, you guys should be writing about how horrifying this all is. So, okay.
Any other questions? If not, thank you all very much for being here.